Thilee Sivananthan is my name. I'm based at IVFAustralia Westmead, and I'm a fertility specialist in the clinic there. I trained in Western Sydney, and after my medical degree, I completed a 6-year program as a specialist in obstetrics and gynecology, and towards the end of that, I embarked on a training program in fertility medicine. Ever since I've completed the training, I've worked pretty much in the Western Sydney area, and I've continued to practice both fertility and obstetrics and gynecology. When I was in training, both as a student and as a specialist, this area of medicine struck me as being particularly dynamic. It's one area that was, seemed to change quite. There seemed to be quite significant advances, over a period of time, and I was always intent on, continuing to practice other aspects of what I was trained for. So I, obviously see patients and work through their fertility issues, but then a proportion of them will stay with me through their pregnancy journey and end up completing the process with the birth of their child. I quite enjoy the aspect of seeing a couple from the beginning and being able to follow them through not only to achieving pregnancy, but potentially also beyond the pregnancy and through the whole of their pregnancy and birth. I'd hope they'd see me as someone who's compassionate, who's relaxed, and some people feel comfortable asking questions of. I'd consider myself open-minded and happy to work with what patients would like, work with the approach the patients would like taken in terms of their care. One particular group of patients I like or have an interest in treating is women with polycystic ovary syndrome, in part because patients often end up seeing you because they have a fertility issue, but often these women also have the potential to develop long-term health issues. So I think there's an opportunity here not just to treat a short-term outcome such as their fertility, but also be involved in their long-term health. I like to find out what they're hoping to achieve from seeing me. I hope to then be able to provide them with information to on treatment, and particularly discuss the pros and cons of different approaches if there's more than one option, and hopefully at the end be able to share in the decision making to reach their goal.